Here we have a taping technique to help assist in the treatment process of medial knee pain. So medial knee pain could be due to a pressure that is building up within the knee joint itself. And this pressure can be driven from up above. So that could be coming from the thorax position, the pelvis position, and with that pressure coming down, it can create a shape change of the femur and also a shape change of the lower leg and the foot. So if we have a situation where the distal femur has turned into internal rotation relative to the proximal tibia going into external rotation, that can put pressure within the joint itself. So this taping technique is just part of the process. We may need to address some of the muscles in the foot, the lower leg, upper leg, pelvis and thorax. So just keeping that in mind. This is just part of the process with the taping technique. So we're going to use the defining motion nylon K tape to hook over the tibial tuberosity to send in a sensory input to the nervous system to internally rotate the tibia relative to the distal femur. So we've got this twisting in, and if we can get the tibia to move into internal rotation, relatively speaking, then we're going to be able to produce more legit force into the ground so you don't have to compensate. So just with the setup, we're going to have the knee elevated on something. And by flexing the knee, that's going to help produce more internal rotation of the proximal tibia. So the more the knee is flexed, the more the tibia will internally rotate. Also, to help with that internal rotation, we're going to put the foot upright against something. Or if you don't have something, then you can just bring the foot so it's upright. Or if you have a wall available, you can push the foot into the wall. So with the opposite leg, because we're going to be coming into the inner thigh, we need to create some space on the opposite leg. So with the nylon K tape, we're going to get our measurement roughly. So I'm going to come over the tibial tuberosity by around 3 or 4 centimeters. And then instead of going over the knee, we're going to come onto the inside of the knee and we're going towards the inner thigh. So we're following roughly the pes anserinus muscles, so maybe the gracilis and the semitendinosus, if we can get a little bit more posterior. But we're roughly following this line here. So that's our rough estimate. And because this is different to a cotton tape, so it's not going to stretch as much. So you just need to get used to the length of tape that you need, because we want to try and create a little bit more tension with the nylon compared to a cotton K tape. So I'm going to cut that roughly. And then I'm going to round the edges, and that's just going to help prevent the tape from peeling. So we're just going to do that roughly. And then we're going to create our anchor. So just making sure before you apply the tape, I've got my foot position, we've got the knee position. Also, we can think about the pelvis position. So the more upright I bring my torso, the more internal rotation is going to happen on the proximal femur. So if we have more internal rotation at the pelvis, then that's going to create more of an external rotation of the distal femur. And that again is going to help produce this internal rotation of the tibia. So with no stretch, we're going to create our anchor. Going to rub that down. And then again, making sure that we have this alignment through the right side. I'm now going to create some tension on the tape, and as I pull the tape, I'm just going to come behind it and push the tape down on the inner thigh. And at the very end, again, 3 or 4 centimeters, no stretch on the tape to make that opposite anchor. And then we're just going to rub the tape to help activate the adhesive. And from there, if you wanted to back that up with a second piece of tape, then that's okay. You can create like a fanning effect. The only difference here is that you may need to just bring your leg to the outside so you can create another anchor, and then come a little bit more medial stroke posterior on the inner thigh from there. So with this taping technique, like we said before, it is just part of the process. You would likely need to address the position of the foot and also the muscles of the lower leg, upper leg, pelvis, thorax. And so this taping technique is what would come at the end. Please feel free to ask us any questions that you may have regarding this taping technique on the comments, or you can find further information about this tape on our website.